Hello everyone, I am Dr. Kona Lakshmi, Minimal Access and Bariatric Surgeon at Yashoda Hospital, Somajiguda branch. Hernia is a very common surgical problem and it needs surgery as the only way of treating it. But when it comes to the results change. Mainly, maybe the individual muscles are not good, or the surgical expertise where they are getting done may not be adequate, or sometimes the hernias are very complex that they need a multidisciplinary way of management. So when we see people with complex hernias, means big hernias in difficult locations close to bony points, or the individual is very sick, or in the like they could be bad diabetics, bad kidney problems, obese, bad cardiac problems, and then they have a big hernia which needs a proper management. Those are what we call the complex hernias. Now complex hernias cannot be treated lightly, because the worst thing about a hernia treatment is the recurrence. So we may think that we have done the best of the surgery, but the hernia can come back. So here the multidisciplinary management is very important. Apart from good surgical skills, you should have a good radiologist who can tell you how to plan your surgery, knowing on the thickness of the muscles, till what extent the muscles are damaged, and a good endocrinologist to support your patient's sugar control, and a cardiologist if the patient has a bad cardiac status and you have to do the surgery, then you need a cardiac support. So complex hernias are best dealt in centers with all this multidisciplinary support, good adequate planning, and preoperative habilitation of the patient. Means that individual should be having a good respiratory therapy, good sugar control his obesity, and have his heart under reasonable control, then only take them up for surgery. And also the surgeon should be very skilled in doing these complex repairs, so that your hernia treatment does not cause repeated surgeries once it is done. So when someone is suffering from complex hernias and thinks of getting surgery done, they should see at those centers which have all these facilities and then come for the surgery. Done in good centers with all these facilities, complex hernias can be treated reasonably well with good results. Thank you.